Yes, so the common myths, I guess, women sometimes feel that perimenopause starts at a specific age. We know that the perimenopause is the time of natural transition before you actually stop your periods, and when your hormone levels can actually fluctuate and cause lots of symptoms. We know that at least 3 out of 4 women will experience these symptoms. So the average age of perimenopause is around the late 40s, but it can actually become earlier or later for different women. Some women may experience perimenopausal symptoms even in their 30s or actually even in their early 40s, while others may not actually start it until they're 50. So it's actually quite different for every woman. I guess another myth also is that some women may not realize that they're having perimenopausal symptoms, as they sometimes think that perimenopause is only about hot flushes. So we know that while hot flushes and night sweats are common symptoms, they are not the only ones. Other symptoms which women may actually not recognize are things like mood swings, joint pain, muscle aches, increasing headaches. They might have problems with sleeping. They might be having problems with dryness with their vagina and actually changes in libido. And for these, women might be seeking alternative reasons for the symptoms that they're having and not really recognize them as part of being part of the perimenopause. And then maybe another common myth also is that some women think that HRT is actually only the treatment for perimenopause and menopause. So we know that HRT, so hormone replacement therapy, is an effective treatment for some women to manage their symptoms, but it's not the only option. It's really important to think about lifestyle changes and as well as dietary modifications, exercise, and also alternative therapies that can really actually help with symptoms. Another myth I sometimes tend to get is that women who come in their perimenopause who have been getting hot flushes and they have stopped using contraception and they're surprised to find that they're pregnant. We know that fertility obviously does decrease during the perimenopause, but it is still possible to get pregnant. HRT is not a contraceptive, and women should probably continue to use contraception if they are sexually active, at least until the age of 55. Staying healthy and active is so important during the perimenopause. It's really essential in terms of managing symptoms and supporting overall well-being. Try and take time out in your schedule to have regular exercise. You know, doing steps and walking are so accessible for everybody. You know, try and take a 15-minute walk every day, if possible, in your lunch break, or incorporate it into your commute to work. Think about engaging in sort of regular aerobic exercise like jogging or swimming or cycling if you can, to try and improve sort of cardiovascular health and manage weight. The other thing that is important to remember is to try and increase your strength training exercises, as we know that a decline in estrogen can reduce muscle mass and bone density. So incorporating sort of strength training exercises can also help counteract this natural decline in metabolism. In terms of exercise, you might want to consider maybe doing more balanced exercises or introducing flexibility in sort of doing things like yoga or Pilates, which we know can improve joint health and reduce the risk of falls. Another important thing to remember is your diet. So, you know, try and focus on a well-balanced diet, which is rich in fruits, vegetables, whole grains, lean proteins like chicken and fish, and even healthy fats such as nuts. Another thing to remember is to try and improve your calcium and vitamin D intake to try and support your bone health, because we know that decline in estrogen reduces this and can cause problems with osteoporosis in the future. So maybe try and increase the amount of dairy that you've got in your diet by increasing milk, cheese, or yogurt if you can, because these are good sources of calcium. Vitamin D can be present in oily fish and also in fortified breads and cereals. And if you can, try and minimize or processed foods, sugary snacks, and try and reduce your caffeine if you can, because we know that these can exacerbate perimenopausal symptoms such as hot flushes and mood swings. The other thing that sort of goes along with this is trying to manage your weight during perimenopause, you know, because sometimes increasing weight is very common in this time, and it can be really distressing for some women. Excess weight often accumulates around the midriff, and this can be linked to the body being less sensitive to the hormone insulin, and this can cause adverse changes in blood sugar and cholesterol metabolism, and can also have links to high blood pressure. So it's really important to try and to maintain a healthy weight through a combination of diet and exercise, as we know that this can also alleviate symptoms like hot flushes and reduce the risk of chronic diseases. So managing emotions during the perimenopause can be really challenging because, as we know, it's the hormonal fluctuations that can lead to mood swings and to the emotional changes. These can be really quite distressing for women. There are several strategies that women can use to help manage their emotions during this transition time. I think the most important thing is to try and educate yourself, really try and understand what perimenopause is and what to expect. This can be really empowering for you. There is a plethora of sort of useful information out there, as well as misinformation. So that, you need to be really careful of what sources you're looking at, and try and move away from sort of unqualified bloggers and influencers, and make sure you're looking at good resources. The other thing, it's also important to be holistic in your care. So as I mentioned before, trying to have a healthy lifestyle in terms of eating a balanced diet. We know that this can stabilize mood and energy levels. We know that regular physical activity can reduce stress, and we know that this can improve mood and also help with better sleep. The other thing is with sleep. We know that when you are in the perimenopause, you can have problems with getting to sleep or staying asleep, and you need to really try and prioritize your sleep hygiene at this time to make sure you get enough rest, because as we know, that lack of sleep can make you feel tired, and this can make your emotional symptoms worse. So along with this, try and, if you can, reduce your alcohol and caffeine, because we know that both of these can make your mood swings worse and also disrupt sleep, as I mentioned before. The other things are to try and think about how you manage stress, because this is a time of life when other things are going on. You might be busy at work, you've got teenage children, you might have elderly parents, so there is a lot of stress around, so you've got to think about how you manage this. It might be worth sort of thinking about practicing relaxation techniques. Think about maybe learning about meditation, or trying to learn about deep breathing exercises or mindfulness, which we know can help manage stress and anxiety. Even things like yoga and Pilates, which are more like mind-body practices, these can help promote relaxation and emotional well-being. Another thing that you might want to learn is something called cognitive behavioral therapy. So this teaches you strategies to manage your problems by thinking about and coping with things in a different way. And this can really help with hormonal fluctuations and how you're feeling. It's best to try and see a CBT or cognitive behavioral therapy practitioner with this, and you might need to access this by your healthcare professional. The other thing is, obviously, don't forget hormone replacement therapy. So HRT, we know, can really help improve mood and emotional symptoms. And we know it's really safe for women, but you'll need to speak to your doctor to try and individualize what treatment you need for you. In other cases, if you didn't want to have HRT, or if it wasn't suitable for you, there are other medications in the form of antidepressants or medications for anxiety, which can help really severe emotional symptoms, such as very low mood, depression, or if you're feeling very, very anxious. The other thing to also remember is to try and talk to friends and family, seek your social support, share your experiences and your feelings with loved ones, and they can provide you with emotional support. Maybe think about joining support groups and help you connect with other women who are going through the same things. All these things can really help manage your emotions during the perimenopause. So obviously we know that the average time for the menopause is 51. So there are many years that you can do, there are many years before the menopause that you can try and keep yourself as healthy as you can. And again, I'm repeating myself because it is so important. You need to try and, prepare for the menopause by trying to maintain your overall health and well-being, while also trying to address the more specific challenges that menopause might bring. As I said before, it's about educating yourself, learn about the stages of menopause, understand what to expect, and that can really help reduce your anxiety and your uncertainty about how you're feeling. Really good websites are, there's the British Menopause Society website, and also the Women's Health Concern. And actually recently there's this brilliant website called the Menopause Wellness Hub, which has lots of information about nutrition, about exercise, about weight, and it gives you lots of tips about what you can do to educate yourself. Obviously, maintain a healthy lifestyle, as I said before, with your diet and your exercise. Avoid smoking if you can. If you do smoke, consider quitting, because we know that smoking is associated with an increased risk of early menopause and other health problems. Obviously, try and limit your alcohol and caffeine, because we know that alcohol and caffeine can help manage, reducing them can help manage mood swings and also sleep disturbances. As I mentioned before, when you go through the menopause, you are at more increased risk of osteoporosis. So you need to make sure that you're having an adequate intake of calcium and vitamin D through diet. And if necessary, you might need to take a supplement. And especially in this country where we don't get as much sun, because obviously we get vitamin D through sunlight, it is recommended that we take vitamin D supplements, especially through the winter months. So these nutrients are crucial for maintaining bone density and help prevent osteoporosis. And also in terms of bone health, think about your weight-bearing exercises like walking and strength training, which can also help preserve bone strength. Another thing to try and also pay attention to is your heart health, so your cardiovascular health, by maintaining a healthy weight, making sure you're having your blood pressure checked and also your cholesterol check and your blood sugar check. And then another thing on that point is to make sure you're attending the screening programs that you're invited to, like your cervical smears, and also you'll start getting invitations for breast screening mammograms from the age of 50. Another thing that women don't always talk about, but it might be worth thinking about discussing with your healthcare professional, is sex changes in sexual health, because that can happen in the menopause. Because what can happen is that you can get vaginal symptoms like dryness and soreness, and this can cause pain during sex. And also menopause can also be related to low libido. Also urinary symptoms can occur when you are having to wake up at night to pass urine, you're having to go more frequently, and you might also be getting a bit of urinary leaking or incontinence. And there are lots of things that can help manage these symptoms, so it's definitely worth speaking to your healthcare professionals in advance, really. I mean, women can definitely support each other, but I guess it's not only about women supporting each other during perimenopause and menopause, it's also about talking to your partner about it, and also your children as well, and making sure that they understand what is going on and support you. It can make the transition much smoother and less isolating. I would encourage sort of open and honest conversations about the perimenopause and menopause. Try and normalize it, because it's something that we all go through. We all have different physical and emotional changes. And try and explain to your loved ones how you're feeling, possibly even share your own experiences and challenges with other women, and in your network, try and help. That might also help others feel less alone. It's worth sort of connecting with other women going through similar symptoms. So you could, talk to your friends, talk to work colleagues, join support groups, either in person or online, where you can advise women and, share experiences and also get emotional support from each other. It's also worth offering your own listening ear and support to other friends and families who might be going through the same thing. I think sometimes it's just worth knowing that if you feel able to speak to somebody, that someone is caring, and it can make such a big difference to you, to how you're feeling. It's also worth sort of thinking about sharing information. So, there are, as I talked about before, there's lots of reputable sources of information. There's articles, there's books, there's podcasts related to menopause. And we know that knowledge can really empower women to make informed decisions about their own health and well-being. And also it's actually sharing information about healthcare professionals who specialise in menopause. I know I've spoken to so many women who go to see their GP, and their GP is not necessarily as well informed as they could be, probably because there is, they may not have haven't got that developed that specialist interest in it. And that can sometimes be a barrier to actually accessing care. So sharing advice about who to see, and also if you can't get that advice from one professional, you might need to go and access it somewhere else. The other thing I would also say is, if you are going to support each other, maybe encourage things that you might want to do together, like self-care practices, like maybe attending yoga classes, exercise classes, maybe going for walks together, I think reminding each other that, you know, that what you're going through is normal, it's not forever, it will get better, and really trying to prioritize time for yourself and then seeking medical advice when you really need it. I would say that a lot more women are becoming really more aware of the perimenopause and menopause transition and its treatments, and much more than they were a few years ago. And I think the greatest advance is that doctors are becoming more confident in how to use HRT in women and how to individualize these treatments. I think women are becoming more empowered about their own health, and they are recognizing that they need more individualized, sort of personalized approaches, and they're trying to get these from the doctors. And I think doctors are becoming more confident in prescribing it. There's also a lot of exciting ongoing research about HRT in women, especially the ones I've been interested in are the breast cancer survivors. So as we know that breast cancer is very common, you know, 1 in 8 women will develop breast cancer in their lifetime. And all of these women go through the menopause at some stage, and some might experience it earlier due to cancer treatments. So early menopause symptoms can be quite severe and quite challenging. And women sometimes present with really awful severe flushes or, you know, low mood and other emotional mental health challenges. They can also have vaginal symptoms. Understandably, patients and doctors are very hesitant in giving HRT to these women, as the majority of breast cancer is hormone dependent. And we're obviously naturally concerned about recurring, so the cancer recurring. So trials are sort of currently ongoing to determine the safety of HRT in this group of women. However, it's really reassuring that trials have shown that vaginal estrogen in the form of sort of vaginal creams or tablets are safe to use in women who've had a history of breast cancer. Studies have shown that there is no increase in breast cancer recurrence, which is great. And this is really useful for women who have vaginal symptoms in this group of women, because they can be really quite debilitating. And actually now you can actually buy over-the-counter estrogen tablets to use vaginally, so that's how safe it is. Another thing also is that there's a new medication that's going to be licensed in January 2024. It's currently available in America, but it's coming out here next year. It's something called fezolinetant, and it's a medication that targets the thermal sort of brain center, thermal regulatory center in your brain, and this can directly reduce hot flushes. So this is not a hormone, it's a non-hormonal alternative, and it can work well with women who have really moderate to severe hot flushes. It can really reduce the frequency and severity of hot flushes and has been shown to also improve the quality of life. This is taken as an oral type tablet, and I think this will be really useful for that group of women who've had breast cancer before and we're unable to give them HRT, and it'd be really useful for them to try and help with these symptoms. Another thing I would say is that, you know, there are so many benefits of HRT, and at the moment HRT is currently really only indicated for women who have symptoms if they're in the perimenopause or menopause, or if they've had a premature or early menopause. And we know that approximately 25% of women actually don't get any symptoms and are very lucky, and they sail through and they are fit and well and have no existing conditions. And then sometimes they come to me and say, actually, I know I don't have any symptoms, but, you know, what are the benefits of actually starting HRT? Because I know it might prevent risks of cardiovascular disease and osteoporosis and dementia. But at the moment, you know, there is still research going on about this to see, you know, if it's actually a benefit for these group of women to actually try and prevent these chronic diseases, but the evidence is not quite there yet. I would say the research is ongoing.